Hello everyone. Today we will discuss about the high-yield topic for pharmacology, which is important for the NEET PG, INI-CET as well as for the FMGE exam. So today we will discuss about the paroxysmal nocturnal hemoglobinuria (PNH). So PNH occurs because of the mutation in the PIGA gene. So PIGA gene mutation results in PNH. Now traditionally we block the terminal complement pathway, that is the C5 inhibition. So C5 inhibition is done by the monoclonal antibodies. So these are the drugs eculizumab. Now how you can remember it? E is the fifth letter of the alphabet. So eculizumab blocks the C5. Ravulizumab and crovalimab. These are the monoclonal antibody which blocks the C5 complement factor. This will ultimately get degraded into C5A and C5B. C5B and C5-9 is responsible for forming membrane attack complex, and this will result in intravascular hemolysis. Now, if we have blocked this C5 pathway, that is the terminal complement inhibition, still the upstream pathway is active, and the upstream pathway is the C3. So complement 3 that you can block by pegcetacoplan. Now CETA sounds like a C3. So this inhibits C3, pegcetacoplan. Danicopan inhibits the factor D. So D stands for danicopan. Iptacopan inhibits factor B. Now C3 gets converted to the C3b and C3d. So that is respectively blocked by iptacopan and danicopan. So this proximal complement inhibition is done by these three drugs. Now this C3 is responsible for the extravascular hemolysis in the spleen. So both the extravascular hemolysis as well as the intravascular hemolysis, this can be blocked by only one drug, and that is pegcetacoplan. So this is very important concept and you have to remember all these drugs. Now let us discuss one MCQ. A patient diagnosed with the PNH has been on chronic treatment with the eculizumab. Despite of the therapy, the patient continues to experience a drop in the HB levels, and workup reveals persistent extravascular hemolysis in the spleen. Which of the following drugs would address both the intravascular and extravascular component of the hemolysis in this patient? Ravulizumab, eculizumab, pegcetacoplan, crovalimab. So as we have discussed in the PNH, the drug which is responsible to inhibit both the intravascular and extravascular component, that is pegcetacoplan, and it inhibits the factor C3. So answer here is pegcetacoplan. So this was about the paroxysmal nocturnal hemoglobinuria and the management. This can be asked in the NEET PG, FMG or in the INI-CET exam. So if you like this video about the paroxysmal nocturnal hemoglobinuria and the drug treatment, then subscribe my channel and follow for more such pharmacology related videos. Thank you.